Our topic is on cerebral vascular accidents. My name is Jovan Wright.
I'm April Winslow.
Jequetta Thomas.
And I'm Robert McIntosh.
First, we're going to look at the definition of a cerebral vascular accident, which is also known as a stroke. It results from an interruption of cerebral blood flow and it leads to cell death and functional disability. Currently, it's the fourth leading cause of death in the United States. There's different types of stroke that includes hemorrhagic, thrombotic, embolic. Risk factors. There are different categories of the risk factors. It's either modifiable or non-modifiable. Some of the modifiable risk factors include hypertension, smoking, diets high in sodium, obesity, and sleep apnea. Some of the non-modifiable risk factors includes family history, older adults, African American, and Hispanic ethnicity.
So pathophysiology of a hemorrhagic stroke. It occurs secondary to a ruptured artery or aneurysm. The rupture of an artery releases blood directly into the cerebrospinal fluid under arterial pressure. Once the vessel ruptures, the blood spreads quickly, leaking into the subarachnoid space and the CFS around the brain and spinal cord, which results in brain or local tissue rapidly increasing ICP. Blood may also spill into brain tissue, where a large clot can cause potentially fatal increase in ICP and brain damage. Rebleeding is common and often occurs within 24 hours. Here's a diagram of CT scan and also a picture showing where the bleed will happen.
Ischemic stroke. This is a stroke caused by an infarction, and the obstruction is caused by a clot that gets inside of a cerebral blood vessel and causes disruption of blood flow. The anaerobic metabolism causes a buildup of lactic acid, which causes cellular death. There are different types of ischemic stroke. The first type is large artery, which is caused by atherosclerotic plaques. Then we have small penetrating artery strokes that are the most common and caused by hypertension, hyperlipidemia, and diabetes. Then we have cardiogenic stroke, which is caused when the heart throws a clot and it travels to the left middle cerebral artery, leading to infarction. And cryptogenic strokes have no known cause but are commonly caused by drug use and migraines. Then we have diagrams of ischemic stroke, and here is dead tissue. And here's a comparison of ischemic versus hemorrhagic, where you have dead tissue and bleeding.
Transient ischemic attacks are acute episodes of temporary neurologic dysfunction, which usually lasts less than 1 hour. They're typically caused by ischemia within the vessels of the brain, spinal cord, or retina. They're not associated with any long-term necrosis or damage to the neural tissue and can be caused by a thrombus or embolus, which can arise anywhere in the person's vasculature. Research shows that TIAs can indicate increased likelihood of a true ischemic attack later on in life, 11% over the next 7 days and 24 to 29% over the next 5 years. Typically, if a person has a TIA, they should remain under observation in the hospital.
Signs and symptoms of a stroke. It depends on the area affected in the brain and also the type of stroke that the patient has, but the most common signs and symptoms include hypertension, facial drooping, severe headache, visual changes, speech changes, and paralysis.
So for diagnostic procedures, usually the CT scan is the first scan that's done, and it may or may not require contrast. It detects intracranial bleeding, cerebral atrophy, and shifts. Most important things to know: you need to obtain signed consent for contrast procedures, and also assess allergies to shellfish, contrast dyes, or iodine. The patient needs to lie still, and for the test to be completed. Secondly are MRIs, which are non-invasive procedures that identify soft tissue and vascular abnormalities. They are more detailed than a CT scan. The most important thing to know about an MRI is that you need to remove all metal objects from the client and watch for burns from continuous pulse ox monitors. Lastly, there's cerebral angiography, which is similar to cardiac cath. It's an injection of contrast material through the femoral artery into the carotid arteries to visualize the cerebral arteries and assess for lesions. You need to obtain informed consent and also assess for allergies to shellfish or iodine as well. And you can see that there.
Nursing management. So what we'd like to do is to maintain the patient airway oxygenation and administer supplemental oxygen based on pulse oximetry levels and arterial blood gas analysis results. Administer pharmacological interventions, which include IV fibrolytics, antiplatelet agents, anticoagulants, and antihypertensive medications. Reposition the client every 2 hours and perform skin assessment and skin care to prevent pressure ulcer formations. Provide a low air loss mattress and pressure reducing alignment devices. Provide the patient with appropriate means of communication.
Clinical manifestations and assessment of a stroke. The clinical manifestations of a stroke include neurodeficits, and for different assessment tools, we have the 8Ds, which include detection, which is recognizing the signs and symptoms of an acute stroke, dispatch, which is activating emergency or calling 911, delivery is transport of the patient to a hospital, and pre-arrival information so the ED can prepare for the arrival. DOOR is when the patient actually arrives to the hospital. Data is the physical and neuro exam. Decision refers to the decision regarding the type of treatment caused or needed for the type of stroke, drug administration, and last we have disposition, which is continuing care of the stroke patient and determining the cause of the stroke. Then we have a scale made by the National Institute of Health stroke scale. It tests for neurodeficits and it's more reliable than the Glasgow Coma scale, which also assesses for the level of consciousness of a patient. And then we have FAST, which is facial drooping, the arms, pronatal drift, slurred speech, and time. So the Glasgow Coma scale has a score between 3 to 15, with 3 being the worst and 15 being the best. Then you have the NIHSS scale, scores a stroke from less severe to more severe.
Medications. If it's not hemorrhagic, tissue plasmagen activator is used and is the only FDA-approved means to treat a stroke. There is also anticoagulants that help, such as heparin or warfarin, antidepressants, antiplatelets, such as aspirin, or antihypertensives.
The nursing process for a patient with a stroke. The nurse should do a complete neurologic assessment, a mental status documentation that includes swallowing abilities, hydration status, skin integrity, and activity levels. Ongoing focus assessments should also be performed. Some diagnosis, nursing diagnosis that a nurse can have on stroke patients are impaired physical mobility, impaired verbal communication, high risk for injury, and knowledge deficit. Planning, a nurse should plan for rehabilitation as for being important for the planning process. Knowing the patient's baseline functioning, also the stroke outcomes based on the person's factors, including age. Providing a realistic recovery information to the patient and the family. Interventions can include improved mobility, enhanced self-care, and improved communication. The patient should demonstrate intact neurologic status and normal vital sign. They should also demonstrate understanding of diagnostic procedure and treatment plan and keep their follow-up appointments to their doctors. What does the general public need to know? Is it a stroke? Check these signs fast.
Face. Does the face look uneven? Ask them to smile.
Arm. Does the arm drift? Ask them to raise both arms.
Speech. Does the speech sound strange? Ask them to repeat a phrase.
Time. Every second brain cells die.
Act
Fast.
Call 911 at any sign of a stroke. References for this presentation will be uploaded on Blackboard's assignment page.
Thank you.
Thanks, Mr. Bailey.